Hi everyone, and welcome to your community partner, brought to you by Lehigh Valley Hospital, Schuylkill, a part of Jefferson. A lot of great things happening, my friends. You know, it amazes me what goes on at the hospital and the great things that they're doing. Today, we're going to learn about the quality awards that they have, many things that happen that affect us. And joining me now is Cathy Sophy, who's the Director of Quality Services here. Cathy, how are you?
I'm good. How are you?
So what do you do?
I am the Director of Quality for Lehigh Valley Hospital Schuylkill. I oversee the quality department, and I help guide our leaders and colleagues to improve the overall quality and safety of the hospital.
How do you do that?
We take a look at our top opportunities, things that we need to improve, and together we work as a team to make those improvements.
Do you get input from other, your colleagues, or
Yes.
to know what improvements you have to
Yeah,
make?
we take a look at publicly reported measures, things such as Leapfrog, CMS star ratings, and we take a look at what our top opportunities are in those areas, and that's what we use to guide us to make improvements.
So with that comes awards.
Yes.
Okay, so many people say, well, how do you get these awards? All right, so let's talk about the first award, the Chartist Award. What is the Chartist Award?
Chartist Award, we were given the 2024 Chartist Award. We were recognized as a top rural hospital. Chartist uses quality metrics that are publicly reported, and they award hospitals that meet the high performing in those metrics. So we received that award for patient outcomes. They use quality metrics, publicly reported data. They use 8 pillars, they call them. And when they give us a percentile ranking in those 8 pillars, we came out in the top 75% of hospitals. So we were one of only 16 hospitals in the state of Pennsylvania to receive that award, and we were the only hospital in our region to receive that award.
So what does that mean to our viewers here?
It means that we provide top quality care for a rural hospital.
And the input comes from the patients that have been here before?
The input comes from publicly reported data. So it comes from things such as our hospital-acquired infections, our patient experience data. So they gather all types of data that's publicly reported, and they grade us on it.
You know, you hear a lot about, Lehigh Valley. To me, they're just raising the bar every year. I don't know what they're going to do this year, because last year was a tremendous year with Jefferson coming on board, which is fantastic. And I think when the people who utilize the hospital and really are affected by the affiliation that we have with Jefferson and what they bring to the table, they really know what a great move that was. In terms of getting, awards, people are always concerned, they get an award, anyone can get an award. But that's why I like to explain what those awards mean. Don't you think so?
Yes, I agree. They're more than just awards.
Yeah.
They show our commitment to providing top quality care and safety for our patients.
So you've been here, what, 6 months?
38 years.
Okay, so that tells me something.
Yes.
When you're talking about staying with a company for 38 years, that really means something, doesn't it?
It does, yes.
What was your feeling when the merger happened with Jefferson?
Oh, it's a very positive experience. Jefferson is a very highly regarded health system, and they provide very high-rated quality care. So it will improve the overall care for all of our patients.
Now, there's another award you had, which is the Stroke Gold Plus Award. Tell me about that.
So we received the Gold Plus Stroke Award, and that comes from the American Heart Association and the American Stroke Association. We are a designated stroke center, and that award was given to us because we use outcome measures, and we performed very high in the outcome measures for our stroke patients. And that shows our commitment to decreasing death in stroke patients and in decreasing disability for our stroke patients as well. The plus portion of that award was given to us because we've consistently maintained those high standards for 24 months or greater.
Wow. And of course, if you're experiencing a stroke, you want to get here as fast as possible.
Yes, fast is the key to stroke. You want to seek treatment as soon as possible.
That's been a hallmark with Lehigh Valley, getting them to the hospital as quickly as possible. The 2024 Excellent Inpatient Safety Award, Program Award. Talk about that.
So the Hospital Association of Pennsylvania gave us the 2024 and 2025 Excellence in Patient Safety Award. And that award was given to us because we have performed better statewide in the standardized infection ratio for 3 types of hospital-acquired infections: central line-associated bloodstream infections, catheter-associated urinary tract infections, and also C. difficile infections. So our performance was better than the standard of other hospitals in Pennsylvania.
I didn't know there's that many infections. My gosh.
Unfortunately, yes, there are.
At least you could take care of those infections. The Leapfrog A award that you get. Tell me about that.
So the Leapfrog A is probably one of the most significant awards that we've received. We have been on a journey for many years to improve our overall Leapfrog safety grade. Leapfrog uses 32 based evidence safety measures for hospitals, and what they do is they take your performance in all 32 of those measures and they assign you a safety grade. And many years ago, we did not perform well with the Leapfrog safety grade. And so we've been on a journey to improve. And for the first time ever in the spring of 2025, we were able to achieve an A rating. And we maintain that now for spring of 2025 and also the fall of 2025.
So, Cathy, tell me about the Family Birth Newburgh Center. You were named U.S. News and World Report, some high performance, right?
Yes, U.S. News and World Report named us a top performing maternity center. Only 25% of hospitals in the United States receive that award, and it shows our high quality for maternity care using specific metrics related to C-section rates, breastfeeding rates. There's a quality metrics that they use to get that award. And we were also designated as a rural access hospital with U.S. News and World Report, which means that we have to show high 75% or greater performance in 10 quality metrics, but we're also designated in a rural area.
It's a team.
It's a huge team. Yes, it takes everybody.
Yeah, yes. And everyone who is participating it's important, that. And I just came from. I was telling Terry, just came from my annual check-in with Dr. Chatlow, who was my cardiologist. I'm so impressed when I walk into any facility here at the Schuylkill, and the kindness, the concern for the patient. You couldn't find a better cardiologist. I'm giving him a plug, Dr. Thomas Chatlow. It just explains everything and makes you feel comfortable. And I think that's what this hospital is all about. They're not just getting people in, and especially now with this flu season and all the pressures. I don't know how they maintain their sanity, But
it's been a very busy season right now. Yeah.
Well, it's great to see that you've been here for 38 years, and it's so nice that you deserve all these awards.
We deserve all these awards. We do. Yes.
Coming up next is the boss.
Yes.
I got to be good with him.
Yep.
My friends are watching a community partner with with Lehigh Valley Hospital Schuylkill, a part of Jefferson. And as you know, if you've experienced anyone at the hospital, you know how great this has been. I want to take a break. We'll have the boss after this. Well, welcome back to your community partner with Lehigh Valley Hospital here in Schuylkill, part of Jefferson Health. My friends, joining me now is the main man, Terry Purcell, who is the Regional Chief Operating Officer. Terry, it's nice to see you.
Nice to see you. Happy New Year.
Same to you. You know what I can't understand? What are you going to do this year that you did last year? It was a fabulous year for Jefferson Health, and I'm seeing all these great things. It's amazing, interviewing Cathy in 38 years, and how with the merger, the greatness of bringing health care to this area. I mean, second to none. It's really great, isn't it?
And just to build off of Cathy's, our goal is continuous improvement. So we're always looking to get better. We're always looking to get bigger. So we never settle. So we had a great year last year, but that's in the past. So we're looking forward to the future and growing in Schuylkill County and the surrounding area.
Terry, you told me that, you take the patient's responses, because like I mentioned, I went to Dr. Chatlow yesterday, and then I got a notice on my email, please respond, did they do this, they do that. That's critical for them to do that.
That's very important. So every day we have a huddle at 8:30 in the morning with all the leadership. And one of the things we review is every survey that came back. Good, bad, or indifferent. We talk about it. 99% of them are great. But those few that we don't meet the patient satisfaction, we reach out to them to see what else could we do to make it better, because we're always striving.
So it's
to
not
make
like
it,
you just throw them aside. You pay attention to that. So,
absolutely.
So this year you have the Pennsylvania Trauma Systems Foundation accredited, okay, at level 4. Now what does that mean?
So we've, as Cathy said, we've been on a roll with getting a lot of awards. You know, these awards aren't won in administration; they're won by our staff.
Yes.
They're won by our nursing staff providing great care. They're awarded by our tech partners keeping our patients safe. They're won by our environmental safety staff by keeping everything clean to prevent infections. So we're just so proud of everything that's going on at Schuylkill. And so we got the level 4 trauma certification. We've had this for several years right now. But what this is that we prepare patients. If we have a trauma patient coming in, we get notified by the ambulance corps. So the care starts out there in the ambulance before they get to the hospital. Then we're prepared when they get to the hospital to provide, we have standards of care that we're going to provide to make sure we take care of that patient. If we could safely take care of the patient locally, we keep the patient. If it's necessary to transfer the patient, we have protocols, and we transfer the patient as quickly as we can to get them to Cedar Crest or Muhlenberg for those patients that need a higher level of
Okay,
care.
so let's go to the point where the ambulance, because that's the first point of contact, okay? And that's where you're really concerned who's, you know, as fast as they get there. But what about the trained people that are there? Do they know what's happening? Or do we have to wait till we get to the hospital, then they start their procedure? Give me a...
So the training starts before anything happens. So we're always out with the ambulance, with the EMS squads, working with them, developing their skills, training them for different scenarios, because they never know what's going to happen. So when an accident happens, they're in contact with our emergency room while they're on the scene. It's called medical command. So they're reporting, here's what's going on. They could hear from the physician if they need some advice on how to handle the situation. But they're preparing, they're taking care of they're the first line of defense, taking care of the patient in the field. And then we know we're waiting for that patient when they get here.
And you're prepared.
And we're all prepared. And soon, there's no time lost. That's the key.
So in some cases, you know, I know if they may have to ship them to, or bring them to Allentown, maybe those decisions are almost pretty based on what they're telling them. They're almost concerned that they know that we're going to have to get the helicopter or get them down.
So being a trauma certified hospital,
Yeah.
there's protocols in place. So these types of patients we know automatically have to go to a higher level of care, and these patients we could keep locally. So we have all those protocols. We're always reviewing them. We're always training. We're always practicing. So when that happens, the patient's getting the best possible care.
Sometimes people feel at home that, you know, well, I'll take them up to the hospital, or I'll take her up to the hospital. Is that a good or bad move?
It depends. For the most part, it's better to get the care immediately from that EMS squad. They're trained. They're great team colleagues of ours, and it's important for those people to see you immediately. So depending where you live, it could be a half-hour drive into Pottsville, depending where you live in Schuylkill County.
And don't forget, you have to stop.
You have to stop.
Now we have the ACC Chest Pain Center. Tell us about that.
Yes, so chest pain. If you're having a heart attack,
We don't like heart attacks.
And if you are, the key is you need to get it in the hospital ASAP. The longer the heart attack goes untreated, the more heart muscle you lose. So it's better, it's worse for the patient the longer this goes on. So we're chest pain accredited. Again, we work with the ambulances. We're training them in the field. We're in communication while they're on the way. What happens, we call what they call an MI alert. So the whole hospital team's alerted that we have a heart attack patient coming in 2 minutes, 5 minutes, so we're prepared to take care of that patient. A lot of patients we could take care of locally, but if not, we have this protocol with Lehigh Valley, and Lehigh Valley has been the leader in the state of Pennsylvania on an MI alert. So what this MI alert is, if we have to transfer a patient out, we have time intervals. We want to get an EKG done this quickly. We want to get this done but we want to get you out ASAP. And our metric is, if you need a cardiac cath, from the time you come into Schuylkill to the time you get that cardiac cath. And the average is 90 minutes, which is absolutely incredible. If you show up in the ER in Pottsville and 90 minutes later you're on a table down in Allentown getting a cardiac cath. Wow. There's some larger hospitals that can't get a patient from their own ER to their cath lab within 90 minutes. So this is incredible. It's great for patient care, and it's really important to their long-term survival. And Cathy talked about our great leapfrog score. So when you get a leapfrog, you get a numerical number, and that translates into a grade, right? So there's 33 Jefferson hospitals. Lehigh Valley Schuylkill has the second highest leapfrog grade out of all the 33 hospitals in the state. So that's the type of quality care you're getting local. And Hazleton's third. So the whole region, we're providing some outstanding care.
Number one, okay. Certified Primary Stroke Center, we talked a little bit
We
about
talked
that.
about that. You know, when you're having a stroke, time is brain. What you want to do is you want to get in, you want to get that medication as quickly as possible, and we need to get you to the right level of care.
Let's talk about the Walter Barron Family Medicare Rural Residency Program. Yeah.
This has been absolutely outstanding. So we graduated our first class last year. We have 4 third-year residents, 4 second-year, and 4 first-year residents. Last year, 3 of the 4 residents agreed to join Lehigh Valley.
That's great.
One of them is in Schuylkill. Her name is Lindsay Martinez. She's also working family practice, and she also delivers babies. So not a lot of family docs deliver babies these days. So we have 2 right here in Schuylkill that are doing that. We have another one that went, Gladys Matthews. She went to our Pine Grove location. Very happy with that. Pine Grove is a busy area, a growing area. There's probably about 8 different primary care physicians in Pine Grove, and we just keep growing and we're getting busier there. The third one went to Allentown. He's going to be a geriatrician, and he wants to come back to Schuylkill at some point. So in this year's third-year class, we have one that's definitely joining us, hopefully a second one. So this is how we're going to replenish our primary care base in Schuylkill County, because we do have a lot of older physicians. And then also very important with our being part of the Jefferson Health, they have a medical school, and every one of their medical students have to do a rural health rotation. And they were all doing them out in western Pennsylvania. Well, Schuylkill is the only rural hospital in the entire Jefferson Health network. So the medical students are doing their rural rotation here. So the first one was from Danville. So we're hoping that these students come in, they fall in love with Schuylkill, and when they decide to do their residency, hopefully they'll consider coming back to Schuylkill. So the residency has been a blessing, and it's really going to be the key to the long-term health care in Schuylkill County.
Have them talk to Kathy. She'll tell them why
That's
she's been
right,
there for
38 years, that's all we need.
Well, Tara, I could tell you is keep up the good work.
Thank you, Sam. Appreciate
really,
it.
The entire team has been fantastic.
We have a
okay?
great team.
Take a break. We'll be back right after this. Well, welcome back. I'm Sam Lassant, and you're watching your community partner with Lehigh Valley Hospital Schuylkill. If you just tuned in, you know we show this show many, many times. Very informative. Joining me now is Devin Petrusky, who is the director here for counseling services in Schuylkill. How are you, Devin?
I'm good. How are you?
I'm good. So tell me about your counseling services.
Yes, so we provide integrated substance use treatment, nicotine cessation, and cross-addiction behavior services. So that includes outpatient counseling on an individual basis, group counseling, one-to-one counseling for the nicotine cessation. We also have an in-depth teen vaping program, which is used as a diversionary program for school districts in Schuylkill County. We go out to the schools and we do sessions with them to learn the dangers of vaping and using nicotine. We also have DUI services at our center. I serve as the DUI coordinator for Schuylkill County, and I have 2 certified providers. My counselors are able to teach alcohol highway safety school for DUI offenders. They do the CRIN evaluations and the drug and alcohol assessments as well. So we have a variety of different services related to the substance use and nicotine.
Tell me some of the, telltale signs that you really should, look at going to counseling.
Sure. So if someone is struggling maybe with issues with just generally in their life, so we tend to say clinically a biopsychosocial background. So if there's physical issues, if they're struggling with emotional or mental health concerns, and then socially their atmosphere, environment, their peer base. So if they're having issues in all 3 of those realms tied to their use, that's generally a good time to seek services. Not only them, but a family member may see an issue, and a family member can also refer a patient to us. A doctor, a physician can refer patients to us. So if their family doctor is seeing issues, they can send a referral to us as well.
I'm sure there's many people that really could use your services.
Absolutely.
But it's the fact that, I'm okay, I'll be all right. No, how do you convince that person who is hesitant, knows down deep that they have a concern and a problem? you know, and it's always a scary thing, you know. I don't want to admit that I failed, okay? I'm sure you've seen these, and so
Yes.
what would be the goal here for some of your patients or clients?
So our goal, we meet the person where they are. So our goal is to ensure that we're providing the best of care we can. We want to meet them where they are. We want to ensure that they have goals that they want to meet themselves, and we create a treatment plan that will help them succeed. So the goal may not be sobriety for them, but the goal may be harm reduction or reducing their consumption or use. We will work with them at that level. So it may not necessarily be sobriety, and that's okay.
Yeah, sure, yeah.
But we'll meet them where they are and try to help them as much as we can. The good thing with us is we do have longevity in our staff as well. I know Cathy had talked about how long she's been with the network, and majority of my staff at the counseling center have been here over 20 years. So there is longevity within our counselors, which says a lot too. And everyone clinically wise has been working in the field itself over 20 years.
All right, for me to come to the counseling services, what's the privacy? Okay, knowing that, you know, I'm not going to go in there and see my neighbor or a friend down the street, or Sam was there, etc. So
Yes.
everyone's concerned about that, and rightly so. Okay,
Absolutely.
okay.
Yes, our center is very private. Every counselor has individual rooms. Those rooms are secured with very thick doors that ensure privacy. You can't hear what's going on in the sessions. We have strict confidentiality laws that we follow regarding state and federal guidelines. So you can ensure that if you're in a group, that group room is closed. What stays in the group remains in the group.
Right.
We have, like I said, the individual rooms are secured. The waiting room is secured. So everywhere is a very secure but welcoming environment. And if a patient would be concerned with any piece of confidentiality, we would always ask that they come to us and let us know so that we can ensure they feel comfortable in the setting.
Now your team. Tell about your counseling services, your team.
Yeah, so my team, two of my counselors have a master's in social work, and every counselor is a certified addictions counselor. So they all have certification through the state board to practice, and we're looking at having all of them certified in trauma-informed care as well. Myself and our CRS worker are both certified already in trauma-informed care, so we're able to ensure that.
So Devin, give me some, as the viewers are watching this, okay, some people may have some addiction, etc. What are some telltale signs that, you know, you really should, the phone number is up on the screen, really should at least give us a call, okay, because, you know, and that person has to make the decision themselves. So maybe the spouse or the partner may say, look, you should really, what are some of the signs that a person would be, you know, should be calling?
Increased usage. So usage has increased over time.
Usage of what?
Of alcohol, drugs, nicotine, anything related to that. Another sign would be not being able to stop using or reduce using, feeling the need to constantly go back, or not being able to function in a life setting without it, feeling the constant stress to use. We have a lot of patients who are using a substance because they feel that they can't obtain like a medication or something else to help them, so they're using an illegal drug instead. So if those are some of the things that are coming about, relationship-wise, if you're struggling within your relationships, or mental health, like I said earlier, if you're having severe anxiety without using a substance, those are signs where you would want to get some help and come to us to talk.
So you encourage a person to at least call.
Absolutely.
Okay, and someone may call and say, look, I'm experiencing a couple things, and, you know, because, again, it's always this hesitancy that I don't really need it, I could quit, and next thing you know, it's worse. Okay, give me very quickly some of the successes you've had with people, some of the clients you've had.
So we've had great success actually with some of our patients. We work a lot with the county court system and the legal system, and we have some drug court patients. And we've seen success with them having sobriety. Actually, this morning before I came here, I just sat in a session with a gentleman. He's 6 months sober from working with us. His primary substance was alcohol. And he said, you know, this has been so great this time around for me that I'm actually not only listening to you, but I'm putting in the work too. That I'm now understanding and internalizing what you're telling me.
And they're great testimonials.
They are.
They get nothing like having, look, I was there, this is what happened to me. And so if any of you have any of those problems, my friends, before we close, some of the locations you operate from?
Yes, so our main location is in St. Clair. We're located at 502 South 2nd Street. It's right by the industrial park area. And then we also operate out of Frackville at our LVPG practice on Thursdays. So we're there during the day. Our hours are always 8 to 4:30, but on Mondays at our St. Clair location, we provide hours up till 8 p.m. to support those individuals who may be working during the day.
Well, I applaud you for doing that, but it must make you feel and your team feel very good when you see a person come in that has all these concerns, and after a while, how great they're doing.
Absolutely.
That's a good success. Well, keep up the good work, Devin.
Thank
okay?
you. I appreciate that.
You're watching your community partner brought to you by Lehigh Valley Hospital, Schuylkill, part of the Jefferson Health. My friends, a lot of great information. Like I said, they're available to you. The phone number's on the screen. Give them a call. They're more than happy to help you. We'll see you next time.